Well, I grew up in Kingsport, Tennessee, Eastern Tennessee, and I have one brother who's an attorney in Atlanta, Georgia. And I originally got interested in urology in medical school at Wake Forest University. And really what it was interacting with the urologists that were at Wake Forest and the residents that were in urology there. I just found a group that I could relate to in a field that was challenging. So that was really the starting off point for urology for me, was Wake Forest. So after I finished medical school at Wake Forest, I matched in urology at UAB and completed 5 years of training at UAB Division of Urology. And it was really the experience in Birmingham, those 4 years, that brought us back to Birmingham and want to ultimately live here and raise our family here. It's a field that's constantly changing and has also embraced technology. So, you know, in urology, you can do anything from microsurgery to robotics to laparoscopy to open procedures as well. But my training was the bulk of the old open procedures we were doing minimally invasively, either with a scope or with robotics or laparoscopy. So it's a great field in those terms. My training has always been with minimally invasive modalities. Not to say we didn't do open surgery, but most of my generation are robotic trained. My strength is probably the patient part of urology. I enjoy sitting down with someone who has a urologic problem and finding a way to relate to them in a way that's understandable. The problem's understandable to them. And that's a challenge because, you know, medicine is its own language. And when you sit down with somebody who is completely unfamiliar with urologic diseases and anatomy, it can be a challenge relating exactly what the problem is and the treatment pathway for that. And so that's probably the most rewarding part of urologic practice for me. But, you know, I practice general urology, but I enjoy, I think all of us enjoy kidney stone disease management the most, just because it's so rewarding. You get that short-term reward of someone coming in who's really, really sick. They look like they're really miserable, and, you know, fairly quickly you can get them feeling better. I'm married. I have 2 kids. I met my wife in college at Davidson College, where we both went to school. I was a classical languages major there. And I actually taught Latin my first year out of college. So between college and medical school, I taught Latin for a year, which was fun and interesting and challenging and all that. But I quickly figured out that I wanted to go the medical route. I have a lot of family in medicine. My dad and my grandfather are both orthopedic surgeons. So initially I thought I would go into orthopedics. And I enjoyed orthopedics, but urology I just found so much more interesting. So that's kind of how that all came about. On my off time, I enjoy playing golf, but also with 2 small kids, I end up spending most of my time with the kids and soccer practices and soccer games and such. But, you know, my wife's also a big runner, so I also run a good bit as well. A real benefit to the way Urology Centers practices urology is you don't have all the doctors doing all the same procedures. You have subspecialization, which is a huge benefit to the patient because you have doctors that are doing a very narrow scope of practice over and over again, so they gain proficiency faster. And we have urologists in this practice that have done more procedures in prostate cancer treatment or bladder cancer treatment than really anyone in the Southeast or even in the world. So a real benefit to urology centers is the subspecialization and the breadth of experience that the doctors here bring.